Hi and welcome to NMIH203 Family-centred Nursing. Welcome back. I hope everyone enjoyed their break and congratulations, you're in your second year of nursing. So what is this subject? What are we all about? So in family-centred nursing, we're going to be building on the knowledge that you developed or that you were introduced to in the first year. So all of your first year subjects, we're going to take them just that little bit further. So we're going to introduce concepts of the family in all the contemporary forms. We're going to look at effective care of women, men and children in urban, rural and remote settings. We're going to focus on the bio, psycho, social, politico, cultural, economic and environmental elements that influence healthcare practices involving patients, clients and their families. So we're really focusing on getting that holistic view, not just patient-centred care, but taking it that step further and making it about families. So how? So this is how we're going to get through this semester together. So there's 2 weekly lectures to be found on Moodle, and sometimes I've substituted the lectures, so per se, for learning activities instead, and they'll be up on Moodle. There's weekly tutorials. They're 2 hours in duration. They are compulsory. You are able to miss one. Anything further, you will need to have a doctor's certificate. And there's additional online activities found on Moodle that's relevant to your tutorial work. And there's lots of additional resources and things like that. So have a look on Moodle. A lot of those additional resources will actually be beneficial for your assignments, which is what we're going to talk about now. So this is how, again, so your first assignment, assignment 1, it's a formative assessment. It's an online multiple choice quiz, which is actually open now already. So it opens on Monday, the 26th. It's compulsory, so it must be completed to pass the subject. You have 3 weeks to complete it, so it closes at the end of week 3, and it's not graded. So what that means is that we're aiming to for you guys to gauge your progress in the subject. So it's mainly based on your first lectures and your tutorials, so the first week, and a little bit on the second week, which will benefit you with your next assignment as well. So if you're understanding things that you are addressing in your second tutorial and your second week of lectures, then assignment 2 will be way easier. So this online multiple choice quiz, it has, you can repeat it as many times as you want to. So assignment 2 is a essay case study. So you'll meet Angela and David while you're working in a rural health clinic. The case study's there and your tutor should read through it. So your main things that you're looking at though is going to be the growth and development, immunizations, geographical isolation and how that impacts on health, antenatal health promotion. So you're going to and the case study, Angela has also identified herself as Aboriginal and Torres Strait Islander as well. So there's a lot going on there. There's a lot of family-centred nursing care that you will be focusing on. So this one's worth 40%. It's 2,000 words, plus or minus your 10% as per normal. And it's due on the 5th of April, just before midnight. So that's your week 6. So AB stream, you guys are on clinical placement then, so just keep that in mind. The last assessment, so assessment 3, is another essay, but this one's an interest essay. So what I mean by interest essay is that you select an issue and that modern families are facing today. So I've given four options. So these are the decreasing rates of immunisation, the increasing rate of childhood obesity, risk-taking behaviours amongst adolescents, and the current ice epidemic. So you're going to choose one of those 4 topics, explain the topic in part 1 and say why it's a target area. So there you're looking at statistics, why, and you're looking at sort of the rationale behind why is this a target area and why it's kind of occurring as well. So part 2, you need to identify a government strategy, state the target audience, outline the strategy, its purpose, and identify some enablers and barriers. So you're looking at what makes this strategy work and why isn't it working. So what's a barrier that strategy needs to overcome? And then part 3, we relate it back to nursing your degree. So what's the nurse's role within that strategy and within that topic as well? So the idea is that you pick a topic that you have an interest in already, so that the research is kind of, it's not as much work, I guess, because you're interested in it. So this one's worth 60%. It's 2,500 words. It's due on the 31st of May, right before midnight. So that's in the last week, so week 13, when everything else is, of course, due and you guys are studying for your tests for your other subjects. So just bear that in mind that you've got this one as well, this interest essay. Textbooks. Now I know that there was a bit of a mix around with textbooks because there was an old edition of the subject outline circulating, and I do apologise for that. So we've got one prescribed text, and I do suggest that you guys, if you haven't already, pop out and grab it. I think it's about $80. Yeah, it's really beneficial. It looks at Indigenous health as well as in that rural and remote setting, so it's going to help you a lot with assignment 2, and you will definitely use this in the future in your nursing course as well, so for next semester as well as next year. There's also another textbook that I use a lot, and this is the Community Health and Wellness in Primary Healthcare in Practice. So I do use this a lot. This is available through the library on your online textbook. So don't feel like you need to go out and purchase this. It is available online through the library website, which I made sure. It is a fantastic textbook. And of course, there's lots of additional online resources, which I've put links to throughout. So this is me. Bailey Trustin, I'm the subject coordinator. That's my office. I'm mainly based at the Wollongong campus, although I am also teaching in southern Sydney. So for that reason, consultancy times, unfortunately, is appointment only because I'm travelling between the 2 campuses as well as working in maternity and emergency within the hospital system still as well. So please just email me. There's my email there, and organise an appointment. So just organise an appointment with me, and I've also got Skype there, but again, you'll have to schedule the call. Feedback and reflection, we're always looking to improve the subjects, so any kind of feedback is welcome. So there's informal, if you do something in a tute and it was good, let the tutor know so that we might do it next year. And of course, there's the formal ways, which you guys are probably familiar with already. So there's obviously the subject evaluation and teacher evaluations that you do at the end of semester. So just a little inspiration. So if you have discipline, drive and determination, nothing is impossible. Thank you.